The Northwest Health Department confirming 2 cases of cholera in that province. That's in the Bojanala district municipality. The 2 men presented with diarrhea and vomiting and were tested. Authorities are urging the public not to panic. To tell us more about what's happening, I'm joined on the line now by Tebogo Lekgethwane. He is the Northwest Health Department's spokesperson. Tebogo, thank you very much for your time and a very good afternoon to you. Just firstly, for clarity, let's start with clarity. With the 2 cases confirmed in the Northwest, is it just 2 cases of cholera and people are being treated in hospital? Or is it the unfortunate news that 2 people have died?
Yeah, very important what you are saying, in particular that people should not panic, because these cases, it is important to stress that they are the Northwest residents, but the tests were done in Gauteng. So as we speak, we do not have any report that indicates that the water in the Northwest, in any part of the Northwest, is contaminated. And we do not have any other cases in the province. We are not even treating anyone in any of our health facilities due to cholera. So the status remains that we are not saying that we have an outbreak. We are only confirming that we have 2 cases that were treated, that were tested in Gauteng, and they have been identified to be the residents of Northwest.
Oh, okay, all right. So I was actually going to ask if this has anything to do with the fact that Hammanskraal is so close to the Northwest. At some point before the demarcation, Hammanskraal was considered to be a part of the Northwest. Could this be the reason why people are saying that it's 2 cases in the Northwest instead of sticking to the cases being in Gauteng?
Yeah, the 2 cases, the proximity to Gauteng is, and in particular Hammanskraal, is very huge. And that is why perhaps a lot of people are wondering if the water might not have come from Hammanskraal to the Northwest. But we don't have that confirmation at this moment. We know that these people were tested in Gauteng, and as it stands, our water is still safe until confirmed otherwise.
All right, let me just ask you this question again for clarity so that we don't give false information and add to the panic for the people of the Northwest. So you're saying that these 2 people are not necessarily people who live in the Northwest. They are from the Northwest, but they were tested here in Gauteng, and that's where they tested positive for cholera.
Absolutely. And of course, just to make sure we do not leave any stone unturned, we will be sending our authorities specific to the families to make sure that they do contact tracing, but also the municipality and the water authority are going to make a follow-up to make sure that if they do extensive testing to make sure that the water is safe that side.
So do you know at all if these 2 added people make the number in Gauteng possibly 25? Or is this part, because earlier on, and I'm just asking you this question in case you have the information, earlier on the mayor of the city of Tshwane, Silas Brink, said they tested most of the 23 confirmed deceased people, and out of the 23, only 9 were confirmed to have had cholera in their system. And I'm wondering if these 2 that we're adding to the Northwest, are they really an addition or are they part of the 23?
No, this at the moment, because this is the report we have, it says they are Northwest people. So they would be counted under Northwest unless we have a different report from Gauteng that could then mean we revisit what we are saying.
And in your contact tracing, are you going to try and see if the 2 confirmed cases did come visit the Northwest, if possibly, whatever they had has spread to Bojanala, for instance?
That's what we want to find out.
All right. Okay. So, and then in terms of your communication with the city of Tshwane, that will obviously be very important because once again, the proximity between the Northwest and Hammanskraal. Are you going to be in constant communication to see if your statistics are going up?
We are already in contact with all the role players, including the National Department of Health, the Water Authority, the cities and municipalities that are affected, to try and deal with this matter.
And then just very quickly, is there any concern from the health department in the Northwest? We all know that water infrastructure issues are not only issues that are here in Gauteng or KZN, for instance. The Northwest has also had, for instance, natural disasters in the form of flooding that could also result in waterborne diseases. Any concern from the Northwest government there?
We are on high alert. That's what I would say, because even 2 weeks back, we had a concern around the area of Taung that the water quality was not that good. But what we have done, we have left it to the municipality to take the water samples to go and test them. In the meantime, our hospital was then using the water from the borehole. But definitely we are on high alert with within all our areas in the province.
All right. Well, thank you very much for speaking to me, Mr. Lekgethwane. We'll probably also still be in contact with you as things develop, just for you to just give us more information, especially because the Northwest is a province that has quite a lot of people, part of them my family as well, that are from the Northwest but living here in Gauteng. So we'll be speaking to you just to get more updates. That was Tebogo Lekgethwane. He is the spokesperson for the health department in the Northwest province.